Hi, I'm Dr. Elliot Goldberg, here to discuss issues or problems with treating ADHD. And one of the situations that can very often occur is you make a diagnosis, you give the medication, whether it's Ritalin or something else, and lo and behold, things aren't better. And there's a process that one needs to go through to figure out why not. And the first thing you need to do is, do I have the right diagnosis? Very often, hyperactivity, inattentiveness, distractibility is not a sign of ADHD, but maybe something else or along with something else, and the medication is not addressing the other thing. The other thing is you got to make sure that compliance. It's known, especially teenagers, just won't take their medicine in a regular fashion. You got to ask and check out that they are taking the medication. And you may get the dosage right. Ritalin does not go by weight in my experience. It more goes by your genetic predisposition and how you handle medications in general. I usually start out on a low dose and gradually go up until I find the dose that works. Sometimes the supposed long-acting ones aren't so long-acting, or they're short-acting, or they're longer-acting, and then the blood levels go up or down, and it's not stable, so you need to play around with that a little bit. And when you finally reach the conclusion that the diagnosis is right, and he is, he's taking the medication, and there's no side effects, and you need to think of the possibility that maybe he just doesn't respond. We know that 10 to 15% of kids with a diagnosis of ADHD, for instance, don't respond to Ritalin or other psychostimulants. Usually switch to another psychostimulant to try it, but if they don't apply to any psychostimulant, there are another group of medications that you can go to, Strattera, some antidepressants, and you play around with that. But another important point is that medication isn't the only thing, and you need the child to go in there with the motivation to change, and if he doesn't have that motivation to change, I'm not sure any medication will work.